Okay, well, I will play the video from our first client, Danny, was at the whole child.
We have about 10 years different in age. I'm her senior, but she has taught me so much. I look at her as a confidant. I look at her as a teacher. I look at her as a coach. I have so much respect for her. Her input has been so crucial to my son's success, to what I've been able to get my son, the resources, the programs, and what we're in now, where I'm at now, where my head's at now. But when you're a parent and you have all these self-doubts, that does reflect on your children. Even if you don't want to think it does, because it's internalized. I'm dealing with it on my own. It's all me. It has nothing to do with them. But it does. And I saw the change in me that helped my son kind of just flourish into who he is. And it's helped me be a better parent. It's just, I can't say thank you enough to this whole program, to Catherine, to the whole child. I just, the relationship that it's built, she's given me the strength to build my community, to open up my mouth, to advocate for myself and my son.
Awesome, beautiful, beautiful words. I see all of the love that this is receiving in the chat. Shout out to Kat.
All right, well, I'm happy to transition this to our next section, and there will be more home visiting day updates later on in this call, so very excited for that as well. Well, good morning, everyone. My name is Anna Gukasian, and I'm a Senior Policy Research Associate here at LA Best Babies Network, and I'm pleased to introduce our data team this morning, Delisa Culver, Monica Charles, and Helen Chan, who will be presenting this year's data presentation called From Support to Success, a Data Snapshot of Family Empowerment. A little bit about our speakers this morning. Delisa Culver is the Manager of Data and Evaluation here at LABBN, where she oversees database development, reporting, and continuous quality improvement efforts across the network of home visiting agencies. With over a decade of experience, Delisa uses data to support and drive change that improves outcomes for children and families. Our next speaker, Monica Charles, is the Senior Data Analyst here at LABBN. A self-proclaimed data diva, Monica is passionate about using IT and data to drive evidence-based public health solutions. And lastly, we have Helen Chan, who is a data analyst at LABBN. She's passionate about using data to support evidence-based work. So everyone, please join me in welcoming Delisa, Monica, and Helen for their presentation this morning.
Thank you for that wonderful introduction, Anna. Good morning, all. Welcome to the summit. I am Helen Chan, and we'll be kicking off our data presentation titled From Support to Success, a Data Snapshot of Family Empowerment. I'm joined by the lovely data stars from the data team, Monica Charles and Delisa Young. Next slide. Before we get into the data, I wanted to do an icebreaker with you all. I know this year has been challenging, and when times gets tough for me, I turn to music and find that after a couple songs, my mood changes instantly. So using the chat, enter a song or some songs that lift your mood when you're feeling down. And I will read them out loud. Okay, Underdog by Alicia Keys. You know, when I was doing research for this icebreaker, I wanted to see what people put in their playlist, and some examples were like Stronger by Kelly Clarkson, throwback to my middle school days. Okay, I'm seeing a lot more responses now. Gospel music, Goodness of God, Bigger by Beyonce. Okay, so we have a Beehive. Girl on Fire by Alicia Keys, DTMF by Bad Bunny, Happy. I Will Survive. I'm not sure who that is by. Calling All Angels by Train. Okay. Feeling Good by Nina Simone. Lots of songs I really haven't heard. End of the World by Miley Cyrus, a throwback. Uh, I Keep by Jill Scott. Careless Whisper, ooh, throwback. Sun is Shining by Bob Marley. I love these responses, y'all. On Time God, Girl on Fire by Alicia Keys again. You gotta be. I love the responses. Okay. Please keep entering your responses, but I'm gonna move this data presentation forward. I hope you found some inspiration from each of your responses and added some new songs to your playlist. Now I'm gonna pass it over to Delisa.
Thank you, Helen, and good morning, everyone. So we'll be reviewing data for the current fiscal year, which isn't quite complete, so keep that in mind. Also, home visitation is a long-term or intensive program, and they do not have the same volume of clients as Welcome Baby. So we are not comparing these programs, but sharing similar metrics. I also want to emphasize that we have so many metrics that we could not include in this presentation, and many sites are performing very well on a variety of metrics. So if your site does not get mentioned today, by no means does that indicate that your site is not a top performer. With that said, our first metric for review is prenatal enrollments, and those numbers are as follows. Welcome Baby enrolled over 1,200 clients prenatally, and home visitation enrolled over 200 clients prenatally. We have a few standout sites that we want to acknowledge. These sites have either maintained a high prenatal enrollment rate, increased their rate from the previous year, or improved the number of clients they enrolled prenatally. Those sites are Antelope Valley Medical Center, Martin Luther King Jr. Hospital, St. Mary Medical Center, Families in Good Health, and Pacific Asian Counseling Services. Congratulations to those sites. We also want to highlight a story that was shared to us, thank you, from Providence Little Company of Mary. We have been able to increase the prenatal intakes because we have made better connections with Torrance Memorial Medical Center's OBGYN clinic and other local clinics in the area. With that relationship, we receive a regular number of referrals. Not all referrals qualify for Welcome Baby services, and those that do not get referred and linked with other services. We are happy with the progress we have been able to make in the outreach front. So this story highlights the importance of building strong partnerships, as these relationships help identify clients who can benefit from our programs. And we're seeing this happen more and more frequently with Welcome Baby and home visitation. Next slide. Next, we present data on hospital enrollments. This fiscal year, there were nearly 11,000 clients who enrolled at the hospital. We have a few standout sites that we want to acknowledge. Again, these sites have either maintained a high hospital enrollment rate, increased their rate from the previous year, or improved the number of clients they enrolled at the hospital. These sites are Miller Children's Hospital, Martin Luther King Jr. Hospital, St. Mary Medical Center, and St. Francis Medical Center. Congratulations to those sites. Next slide. As it relates to hospital enrollments, we wanted to share additional data we have to further support the work that impacts families. Many of you all may know that First 5 LA funded a Welcome Baby study that evaluated how virtual visits impacted maternal and child outcomes. The study also examined how these outcomes differ from a comparison group, and that group was WIC recipients, and they did not receive the Welcome Baby program. We will share a couple of other findings from this study later in the presentation. But one of the key findings showed that during virtual implementation, enrollment increased by 34% compared to pre-virtual visits. So though most visits are now conducted in person as the program was intended, this finding brings insight into how families may like to be engaged and also underscores the importance of flexibility in visit delivery. And I know many sites will now offer virtual visits if an in-person visit is an absolute barrier for the family, thereby adopting that flexibility to meet the needs of families. Next slide. Now let's look at postpartum enrollments for the home visitation programs. Over 800 clients enrolled in home visitation this fiscal year. 635 of those enrollments were from outreach efforts, and 169 were from Welcome Baby Hospital referrals. Over the past couple of years, we are seeing that more referrals are coming from outreach efforts, which involve building partnerships in the community and likely more coordinated efforts. So we see you and we appreciate all the home visitation sites pivoting to ensure that we are serving the clients in our communities. We have a few standout sites we want to acknowledge for their consistent enrollment efforts and/or improving from the previous year. And those sites are Child Care Resource Center, Pacific Asian Counseling Services, and Shields for Families. Congratulations to those sites. Next slide. Now let's look at completed visits. For Welcome Baby, over 28,000 visits were completed this fiscal year. Wow, that's a lot. We also wanted to zoom in on specific completed visits. So over 7,600 registered nurse visits were completed. And there were also over 4,600 visits in which the partner attended. And this is amazing to see, as there's been a great focus on getting the partner or father more involved in the program. Lastly, over 21,000 visits were completed in person in alignment with the intention of all the home visiting programs. So this highlights the resiliency of all of you doing the work and having to shift from in-person visits to virtual visits and then back to in-person visits. Next slide. For home visitation, over 31,000 visits were completed. So wow, again, that is a lot. Over 1,000 visits had the partner in attendance and over 22,000 visits were conducted in person. We want to highlight a story that was shared by Children's Institute, Inc. One home visitor also recently shared having their first home visit where father of the child participated in the visit after mother had been participating in the program for almost 2 years. Home visitor joyfully shared looking over at mother and father engaging in a child development activity with their child and being touched by the moment of seeing their interactions together. Home visitors shared hopes to continue having both parents in the visits. This story is so powerful because it highlights the power of persistence and relationship building in home visiting. And after nearly 2 years of working with the mother, the father's participation marks a meaningful step toward greater family engagement. It shows how home visitors help foster stronger parental bonds, promote shared parenting, and creates impactful moments that support child development and family connections. I love this story. We will now get into demographic and impact data, and I'll turn it over to Monica to kick that off.
Thanks, Delisa. I'll start off by painting a picture of the families we serve. These metrics have remained fairly consistent over the years. Our network serves a diverse client base that collectively speaks over 50 languages. In terms of race ethnicity of our client population, over 3/4 of caregivers identify as Hispanic Latino, 9% identify as Black or African American, 5% as Asian, 5% as white, and 4% identify as another race ethnicity. We also want to touch on housing. Around 4 to 10% of the families we serve experience housing insecurity. This range reflects that around 4% of clients who enroll in lighter touch programs like Welcome Baby may experience housing challenges, while closer to 10% of clients who enroll in HFA and PAT experience this stressor. And this is consistent with last fiscal year, and we want to recognize the additional effort and dedication by both home visitors and the families who enroll to commit to home visiting programs. Next slide. Now we're going to move into talking about program impact. The 6 to 8 week checkup with a healthcare provider is a key touch point for postpartum moms. This visit is crucial for prevention and identifying postpartum health risks, and it is an outcome measured by health plans nationwide. This chart shows that 86% of new mothers in home visitation and 89% in Welcome Baby attended the postpartum checkup this year. The Medicaid HMO population on the right of the chart is most similar to the families we serve, and this comparison especially highlights our network's success in supporting families to attend the visit. Next slide. Our programs continue to do an excellent job with screening for postpartum depression. To avoid potential negative impact on caregiver and baby's livelihood, it is critical to identify caregiver depressive symptoms early on. This way they can be supported and linked to services. And I think this story from Miller Children's Hospital really highlights this. The client said, after being diagnosed with postpartum depression, the program connected me with several valuable resources. The in-person meetings reassured me that I wasn't alone and allowed for deep, meaningful conversations. This experience has been a vital stepping stone in my journey through motherhood. This speaks to how impactful home visiting support can be in the early postpartum period. When having a newborn, there's so much focus on baby, and rightfully so, but our programs really take care of mom and the whole family too, which makes a world of difference. Next slide. Another outcome to highlight early on in the postpartum period is safe sleeping for baby. Recent research shows that sudden, unexpected infant deaths are unfortunately increasing nationwide. One of the key strategies to prevent these deaths is promoting safe sleeping arrangements, especially always placing babies to sleep on their backs. In our programs, 94% of HFA and PAP families and 99% of Welcome Baby families receive safe sleep education by the time baby is 2 months old. And this education works. At the 2-month visit, 92% of HFA and PAP families and 99% of Welcome Baby families reported placing baby to sleep on their back. These rates are particularly impressive compared to national and county averages. With federal funding for sudden infant death prevention now being cut, the success of our local programs is more important than ever. Next slide. Using the Ages and Stages questionnaire, our programs also continue to screen for developmental delays at a high rate, especially when comparing to the state rate. The emphasis our programs place on these child screeners mean that families are more likely to receive the services needed to mitigate potential delays early on. This story from El Nido Family Centers is a great example of just this. During the 18-month screening, client reported a low score in child's language domain. With support from their home visitor, the client submitted a referral to Regional Center. Client's knowledge of past ASQ results assisted her when speaking to the intake coordinator with Regional Center. And this spring, child started speech therapy, occupational therapy, and feeding therapy. Not only did this PAT home visitor support the family's early identification of a potential delay, they were also key in facilitating a successful linkage to early intervention services. And I also love how this story highlights the way client felt prepared and knowledgeable when coordinating with the staff at the regional center, thanks to the program's emphasis on developmental milestones. Next slide. Breastfeeding is linked to reduced risk for many illnesses in children and mothers. Strategies like peer support and breastfeeding support can help more caregivers breastfeed for longer. National guidelines recommend continued breastfeeding for at least the first year of baby's life. When looking at the 1-year mark in our longer-term home visitation programs, 42% of families reported that infant was still receiving breast milk, which is approaching that National Healthy People 2030 target. The success of our programs is also notable when looking at the rate for the comparison group, WIC recipients nationwide, which is 28%. And although we don't measure the 1-year time point with Welcome Baby, the Welcome Baby study did note a compelling finding around breastfeeding support. Many Welcome Baby participants identified breastfeeding support as the most helpful resource provided by the program. And that chart on the right from the study shows that compared to other families, Welcome Baby participants were more likely to receive critical breastfeeding support soon after giving birth. Now I'm going to pass it over to Helen, who will continue sharing about program impact and the resources that our network provides.
Thanks, Monica. Now I'm going to go over community referrals. Community referrals are especially important to mothers as they connect them to trusted resources, support networks, and essential services that promote their well-being and their family's health. This year, we had over 18,100 successful referrals. The most referrals were made in charitable services, parent support or education group, lactation support, and food needs. Now, I want to take the time to list our standout sites. These sites gave the most referrals. In Welcome Baby, St. Francis Medical Center, and M&A Health Queen of the Valley gave the most referrals amongst all Welcome Baby sites. For home visitation, Families in Good Health and Shields for Families gave the most referral. Thank you all. Next slide. Now I want to talk about referral categories that increased compared to last fiscal year. This year, we saw more referrals made for immigration legal services, which resulted in a 42% increase across Welcome Baby and home visiting programs. There is also a 42% increase in employment or job training and an increase in maternal mental health as well as early childhood treatment. Next slide. Next slide. Now I want to share a story regarding community referrals from the Children's Clinic. Our bilingual family support specialists, working with mostly the immigrant community, were able to provide education and support to those families affected by the new administration. FSS, or Family Support Specialists, were able to download, print, and distribute several red cards to help these families assert their rights and defend themselves in many situations, such as when ICE agents go out to their homes. FSS also referred several families to Know Your Rights workshops, community immigration rights, through their local community resource center. Thank you, the Children's Clinic. We appreciate your help and support to the families we serve. I also want to take the time to highlight a resource page for immigrant families our wonderful communications team created on the Stronger Families blog. On this page, you will find webinars, red cards, and other materials. If you scan the QR code on the PowerPoint slide, it will take you directly to the resource page. Next slide. Okay, now I want to move us over to Welcome Baby program completion. So this year we had over 5,500 graduates in the Welcome Baby program. Congrats, everyone. So happy that we touched so many lives this year. The Welcome Baby study found that Black African American families had a higher rate of program completion with virtual visits, which highlights the value of flexible and accessible support options. The 2024 study also found that enrollment and completion rates increased substantially. I want to take the time to highlight our Welcome Baby partners who had the highest number of Welcome Baby graduates and the greatest number of completed cases. These are St. Francis Medical Center, M&A Health Queen of the Valley Hospital, Miller's Children's Hospital, and Providence Holy Cross Medical Center. Next slide. We just talked about Welcome Baby, so now it's time to give some love to home visitation. This year, over 190 families graduated from the program and over 520 families who have been enrolled for over 2 years. So happy to see that we have touched so many lives just this year. Now I want to show Whole Child. A home visitor reflected on supporting a resilient family in 2019. The mother, a domestic violence survivor, faced eviction while caring for a nonverbal toddler and a newborn. With help, the family accessed housing support and developmental services, including autism resources for the daughter and intervention for the son. The COVID-19 pandemic added challenges, but the family persevered through unstable housing. The family has secured stable housing and recently graduated from the First 5 PAT program. This is so amazing to hear. Thank you for supporting the family pre and post pandemic. What a journey. Next slide. I want to now talk about client satisfaction. Using data from the Welcome Baby Client Satisfaction Survey, we found that 98% or very often, families would say that their parent coach helped them build their confidence as parents. Similarly, 98% or yes, definitely said that they would participate in Welcome Baby again. Lastly, 99%, well, almost 100% said that their parent coach provides information or support in a way that respects their beliefs. This is in alignment with the Welcome Baby study, as the study mentioned that families were overwhelmingly satisfied with support. Additionally, parents reported higher levels of parenting confidence compared to the comparison group. Next slide. Before I conclude the presentation, I wanted to share a story from a family who received services from Providence Little Company of Mary, sent in through the Welcome Baby Client Satisfaction Survey. They said it was reassuring when the nurse would share best practices available at no cost resources and encourage specific actions to take to improve baby's development and well-being. I appreciate that both partners are encouraged to participate and not just the birthing parent. This emphasis empowers both parents to be equally present and involved. The Welcome Baby Spiral book is a great resource that I wish I had in previous pregnancies or births. It includes so much good and helpful information from stage to stage, and it reinforces and supports what we discuss in the visits. On the slide, you'll see a screenshot of the Welcome Baby book and a QR code that will take you directly to the Stronger Families blog, which provides links to download the Welcome Baby book in either Spanish or English. Next slide. Now, this concludes our presentation. I want to take the time to thank our wonderful director, Charlene Bazalians, the LABBN data team, the LABBN TA team, and the communications team. We appreciate the collaborative efforts across different teams. Thank you so much.